My name is Elle de Moll. I'm a dermatologist in Connecticut. I did my training at the University of Connecticut and specialized in dermatology at Mount Sinai in New York City, where I had the opportunity to study with Andrew Alexis and the Skin of Color Institute at Mount Sinai, and then pursued my special training in dermatopathology. Psoriasis is a surprisingly common skin disorder affecting 2% of Americans across the board, across all races and ethnicities. It can present as all dermatologic conditions differently in skin of color. And unfortunately, sometimes our dermatology curriculum may not be the best at educating dermatologists to recognize skin disease as it presents in skin of color. So it may go misdiagnosed or underdiagnosed for longer. There's also a poor distribution of dermatologists. They're not equally distributed throughout the country. And so with one dermatologist per million Americans and having them scattered unevenly, many Americans just don't have access to dermatology care. I think it's definitely something dermatology needs to work on. There was a study in 2014. It was a small study where African American women had scalp and hair loss complaints. Only a small percentage of those women actually went to the dermatologist, and the majority, 68% of them, felt that the dermatologist was poorly trained and poorly addressed their concerns, was unaware of their hair care issues and what they were going to be experiencing. So I definitely think, studies have shown it that it's what my patients experience frequently. So there's got to be an active plan in the dermatology community to address issues in skin of color patients. The medical literature is moving that direction. There's starting to be a greater focus in textbooks and curriculums at showing rashes. The first thing in dermatology is learning by seeing. You have to see a lot of images to get familiar with something. So more textbooks are focusing on including those images. And at many of our, academic meetings now, there are lectures presented by the Skin of Color Society that seek to teach, our entire community more about making sure we're addressing those concerns properly. So everyone needs to make the effort who's not comfortable, go attending those lectures and paying attention, taking notes and learning something new.